What gene mutations does molecular testing find in thyroid nodules? Imagine a tiny bump in your thyroid that might be harmless or could be something more serious. To figure that out, doctors use molecular testing to look for specific gene changes that can tell us a lot about the nodule's nature. This testing is especially helpful when the usual scans and biopsies leave some questions unanswered. It helps doctors decide whether surgery is needed and what kind of treatment might be best. One of the most common mutations found is in the BRAF gene, especially the BRAF 600E variant. This mutation is strongly linked to papillary thyroid carcinoma, the most common type of thyroid cancer. It causes the BRAF protein to stay active all the time, which promotes tumor growth and survival. If this mutation is present, it usually indicates a higher chance that the nodule is malignant. Another group of mutations involves the RAS genes, including HRAs, NRAs, and CRAS. These are often found in thyroid tumors that have a follicular pattern. RAS mutations activate pathways that encourage cells to grow and divide, which can lead to benign or malignant nodules. Their presence can help distinguish different types of thyroid lesions and guide management. Mutations in the TERT promoter are also important. These are linked to more aggressive thyroid cancers and can suggest a poorer outlook. Detecting TERT mutations can alert doctors to the need for closer monitoring or more aggressive treatment. RET gene mutations and RET PTC gene fusions are associated with medullary thyroid carcinoma and some papillary cancers. Germline RET mutations are inherited and linked to hereditary syndromes like multiple endocrine neoplasia. Identifying these mutations can help with family screening and tailored treatment options. The PAX8 PPAR gamma gene fusion is often seen in follicular thyroid carcinomas. It affects how genes related to cell growth are regulated, which can influence how the tumor behaves. NTRK gene fusions are less common but important because they can drive cancer growth in some thyroid cancers. These fusions are targets for specific therapies that can be very effective. Mutations in the TP53 gene are usually found in more aggressive and poorly differentiated thyroid cancers, including anaplastic thyroid carcinoma. Detecting TP53 mutations can indicate a more serious disease course. Modern molecular testing panels, like ThyroSeq and Afirma, use advanced sequencing techniques to detect these mutations, gene fusions, and other genetic alterations. These tests analyze many genes at once, helping doctors assess the risk that a nodule is cancerous. They can also help decide if surgery is necessary and what kind of surgery might be best. The results from molecular testing are often grouped into categories like BRAF-like or RAS-like, which give clues about how aggressive the tumor might be and its likelihood to spread. For example, BRAF-like mutations tend to be associated with more aggressive tumors that may spread to lymph nodes. It is important to remember that molecular testing is one piece of the puzzle. Doctors combine these results with imaging scans, cytology from biopsies, and the patient's overall health to make the best decisions. While these tests provide valuable information, they are not perfect and should always be interpreted in context. In summary, molecular testing for thyroid nodules looks for mutations in genes such as BRAF, RAS, TERT promoter, RET, and TP53, as well as gene fusions like RET PTC, PAX8 PPAR gamma, and NTRK. These findings help doctors understand whether a nodule is likely to be benign or malignant, how aggressive it might be, and what treatment options could be most effective. Always consult with a healthcare professional for personalized advice and management.